Good afternoon. This is Rachel Leventhal-Weiner. I'm the Chief Research and Planning Officer at the Office of Early Childhood. And we are very grateful for your attendance this afternoon for our webinar, A Day in the Life of Childcare as We Know It. We have with us today Commissioner Bye and a host of providers who have been providing care to children across the state during this pandemic emergency. And we're going to be hearing from their stories and learning from their practices. We are able to offer live Spanish interpretation of this webinar. If you have not received an invitation to that live stream link, please use the questions pane to send us your email address and we'll get you connected to that as quickly as we can. And you can also use the questions pane throughout the webinar to send us questions or ask or offer feedback. So with that, Commissioner Bye.
Thank you so much, Rachel, and welcome everybody. I'm so glad you're here today. I'm going to be brief. You've all heard a lot from me. And really, this part of the reason we're having this today is a very specific request from you all, from providers on our other webinars. You asked for some specific guidance, and we've been working with other programs, some of our other programs providing this guidance, and so we're really happy to provide it today. Childcare is really essential right now as families are getting back to work. But we also want to make sure our staff and the children and their families are as safe as they can be as more and more programs reopen and as we change some of the guides and criteria. So we're glad you're here today. Just to let you know that the guidance is not something we sit in a room and make up. It really is a combination of very thorough understanding of what the CDC guidance is. We work closely with the Department of Public Health. We listen to providers who've had success, who you're going to hear from today. I think very often you would agree that some of your best professional development comes from your colleagues who are implementing every day. And we have a lot of providers who've been open throughout the pandemic, and we have some that are just reopening and anxious about that and want to hear best practices. So we're glad to have that. Our licensing team is such a great support to this process. Deb Johnson and her team really help us try to be as clear as we can be, because you go to them with questions and then they bring those to our guidance and we use your input there to help. And so many at OEC have been working to bring you this guidance, and also grateful for Maggie Adair. We do have a guidance booklet for both family childcare and home-based childcare that you can take and print out. It'll be available on our website via PDF. And you can also share it with your families. You know, this isn't meant to be a big secret. You can explain to your families that you're following CDC guidance and OEC and DPH guidance. So I hope you find it helpful. We had a lot of memos and you said to us, please make this easier on us than sorting through all your memos. And through the hard work of folks at my agency, we did that. I want to just give them a shout out, because this has been a long few months, as it has for all of you. And our team is doing their very best to hear your concerns and respond to them. And we're making changes regularly on your behalf. So I want to give a real special thank you today, shout out, thank you to the existing providers who are going to be part of telling you how they've implemented best practices for public health guidance throughout the COVID emergency. And even as Connecticut's doing so much better, so grateful to be in Connecticut, where so many people like you have helped reduce the spread of this virus. We want to keep that going, and we want to support you however we can. So I'm going to turn it over to Deb Adams and Michelle Levy, who've been instrumental in putting this together for you. So thanks to them, and Deb, take it away.
Thanks, Beth. Yeah, this is a really important webinar today to help people listen to the stories of providers that are open, and to help you walk through the guidance that's going to be out very shortly, some of the revisions to the guidance. So I'm Deb Adams from the Office of Early Childhood, and I'm joined today with Michelle Levy, my colleague at the Office of Early Childhood, and we'll be taking you through the stories of some of our providers who have been open. But we're going to do this in a way that you're familiar with. We're going to do this in a way that you understand through the routines of a day. So we all have routines, right? Adults have routines, children have routines. So we're going to be telling stories through the routines of a typical day in a childcare program. but is it really typical given the time of COVID? You're hearing lots of information, and it's a lot to take in, and it's a lot to figure out. But we want you to have meaningful connections to the information. So to have those meaningful connections, we want to put that in a basis of what you already know. And you already know that children have typical routines. Families have routines every day coming into programs. So take a deep breath. Listen to the stories of our providers and panelists today, and we're confident that with common sense and ingenuity, you will see yourself and your program in these examples and be able to plan for environments that are healthy, safe, and educational. So with us today, we have four programs. We have Jenny Rinaldi, Director from World of Imagination 2, Lynn Weiner, Director from Yale New Haven Hospital Daycare, Christine Weston, Manager Infant Toddler Room at Yale New Haven Hospital Daycare, Shailene Lopez, Program Manager, City of Hartford Early Learning Centers, David Morgan, President CEO of Team Inc., and Jamie Peterson, Director of Early Childhood at Team Inc. So let's start our day off through the routines of coming in during the morning. And we're going to start off with Jenny to share what happens when you come in the morning. So Jenny, go ahead, let's take it away. Jenny, you have to unmute yourself. There you go. Oh.
Okay, thank you.
There we go. Okay, thanks, Jenny.
I'm going to walk you through the arrival time. Upon arrival, children are met at the door by staff members wearing a mask. The staff member performs a short health screening, which includes a few questions, a visual scan of the child's physical appearance, as well as a temperature check. The temperature check is no longer required, but we as a center plan to continue this practice, and other centers may as well. At the conclusion of the intake process, the staff member encourages the child to say goodbye to the adult who's dropping them off. The staff member then proceeds to assist the child in washing their hands and brings the child to the prospective classroom. This entire arrival process is new and maybe even scary for the children. We, the child care providers, are here to comfort the children during this pandemic, and we're working hard to show our loving and caring personality from behind masks. Deb, back to you.
Thanks, Jenny. And I want to keep you on camera here for a second because I want to ask you a question about the general health screening. So when you're looking for signs of illness, not just the temperature checks, what generally do you look for?
We just check for fatigue. We check for unusual behaviors from that child. These are children that we know who have been in our care for a good amount of time and maybe even new to us, but extra clinginess to parents or, rosy cheeks and looking flushed and just a little, changes in their normal, regular, everyday appearance.
Great, thanks, Jenny. And, so what you heard, everybody heard, is a lot of what generally happens normally in following screening procedures. When you look for children coming in and you're observing children coming into the program, part of your normal routine, even in non-health crisis times, is to really look for our children looking well. Are they looking unwell? What are the signs of being unwell? And in the guidance document that's going to be out really soon with revisions, some things like making sure that, children aren't coughing and sneezing and they generally look, being unwell. Use those observations as your normal routines. Temperature checks are no longer required. They were required for a little bit of time, but that has now been lifted. So if you choose to continue to do temperature checks, make sure that you check the CDC guidance on how to do them appropriately. But again, a very normal routine of checking out people, observing people, and make sure you do it from a safe distance, 6 feet away. You may even want to be behind a barrier if you're not wearing a mask, but definitely, thanks Jenny, masks are definitely required, and 6 feet away in terms of when you're observing children. So thank you for that. So now we're into the classroom, we're into the building, and
Deb, can I?
yes.
Deb, can I ask just a couple of questions came in just about that kind of screening routine. Wondering about how long it takes to get all of the children in the door. I know that's one of the concerns that came up and was one of the reasons that the temperature check is no longer required, because of the time that children and families might have to spend it standing in line and waiting to get in. So I don't know if the programs have any information or thoughts about how long it took and whether or not they had a specific staff member or classroom staff conducting those screenings.
Sure, I'll bring it back to Jenny. Jenny, do you have any suggestions for people that might have a line out the door and what's been done?
We do have specific teachers who do the check-in. I think it depends on how your how your location is set up. I know some people have different entrances and use different entrances during this time, who may have only had one entrance at a regular before COVID, but now take advantage of using those different entrances and exits for the sake of not exposing too many people to the same germs. I think it depends on the setup of building. I think it depends on how many staff you can have. As we all know, there's a financial piece of this too. And having too many staff members you're not always able to do so. But for us, we do have people who are set that do the intake process and bring the children to the appropriate classroom.
Thanks, Jenny. So everybody's situation is going to be different. And we all do the best we can with the environment that we have and the facility that we have. And thank you for the questions, and we're going to keep collecting them as well. And so if we get more questions about certain topics, we can get back to you also and add things to our FAQs. And again, the guidance document will be out with any new revisions very soon. And it does have suggestions about possibly asking parents about staggered start times, making sure that there's 6 feet distance between families coming in. If you have multiple entrances, there could be multiple entrances that you could utilize as well in bringing parents into the building. And of course, trying to assign a staff member that is in charge of bringing kids from the entrance to the classroom. So those are just a few ways, but again, use your creativity and ingenuity in thinking about trying to be safe, wearing a mask, and doing what works for you and your environment. So thanks, Jenny. So we're now down the hall and we're coming up to the classroom, and we want to make sure that our classrooms are engaging and full of fun. So we're going to turn it over to Lynn and Chrissy, and Lynn's going to start us out with talking a little bit about that important social and emotional development. So take it away, Lynn.
Hear me? This was a very challenging time, especially regards to social and emotional bonding. When it first came out, it was something even I didn't know how we could handle in early childhood classrooms. There was stress among staff. Why are we open? Why would we close? Families were concerned about procedures, and children were experiencing something in the environment that they saw that the staff and the families had never experienced before. And it created a different environment. The most important takeaway that I will offer is the togetherness in the decisions that we made. We listened to everyone's concerns and thoughts and integrated them into the decisions that we came about. But as I started looking closer to the rules and the guidance, I realized that a lot of our early childhood classrooms, we do this every day. We're diligent about knowing children. We're diligent about knowing the families, the differences in their health concerns and their emotions. And we are conscientious about cleaning throughout the day, morning, afternoon, after the children leave, before they come. But the health and the social interactions, as well as always remembering to continue these, was very important. And I will say most of the staff got very, very meticulous about the cleaning during that time. But in that regard, the relationships are the strongest area of growth and development for children. Children need to experience and express their own emotions while also learning how to express and manage their emotions, which is so important because they have to form those strong bonds with the adults and the children. And this was so different with all the regards to social distancing, masks. So due to the COVID-19 pandemic, it was most important to stay safe. And these typical aspects of child development engagement were somewhat limited in ways that none of us had really ever experienced. So this is a very new to us, but it was also so important because I knew from day one that no one can go to work and have their mind at their job if they were concerned about the safety or the well-being of their child or any other family member. So keeping all of that in mind, I knew that the children, the staff, and the families all had to be integrated into similar, but now new and different ways of doing things. Daycare is so important with the bonds that we make, trust, security, and the joy, that we continued it in new and different ways. And we will continue to share those particular elements and examples with Chrissy as she comes on and talks about her day in her life in the early childhood classrooms in the infant toddler rooms. Chrissy.
Christine, I think you're muted.
Okay. Hello, everyone. I want to share with you first that there's a lot of preparation that happens before children actually enter into the classroom. The teaching staff in the program really look over and review all the policies and suggestions and information from the CDC and from the Office of Childhood Education in order to make sure we're all on the same page and providing the best care for our children and our families. And also that involves in setting up the environment of the classroom, which is so important, especially in this piece about social distancing. Before, we used to be able to play and enjoy and connect with each other in free giving ways for those experiences of children bonding together and also bonding with their teachers. But now in this pandemic, we had to really look at our classroom environment, set up our classrooms, and even eliminate some furniture pieces or materials that was kind of in places that we needed to share open space for children to have individual play on their own or have small groups of just 2 or 3 children, which is so important with social distancing. And especially when children are having those moments of challenges with each other and need to have a teacher come and share some time with them to direct them, to guide them, and to be safe. Thank you, Jenny, for sharing your piece about how children and families actually enter into the program. And that was very helpful for what happens next when they come to the classroom. One important thing that all the teachers agreed on is that we must continue to share our joy in having our families and children come back to our family, to our program, to show them happiness, joy, excitement, and also love, and greet them with those kinds of things in mind. Also, there might be opportunities where a little one might need a hug and just need some support. And I know with the mask on our face, it can be a little scary. And we want children to know, we're here, I'm your teacher, remember me? And give them the comfortable moments of where they feel secure and safe. I also want to talk about, it's very important when you set up your classrooms that you place yourself in areas where you can have conversations and dialogue with children with their developmental skills that you're working on and those wonderful milestones that they're going to be accomplishing. They still have those opportunities every day in our classrooms and knowing that they are getting the best education as possible. Teachers also will be there to verbally guide children, and when they are finished with their materials and the activities, we will clean them, we wash our hands in between different lessons that we may be working on, and we also talk about having a plan for the program and the classroom to have as a checklist as well, to make sure throughout the day the teachers and the staff have in their forefront of thinking always being safe and having cleanliness, sanitizing things and cleaning solutions ready for those toys that need to be tossed into a container so they can be bleached and be able to use at another time. And also having enough materials to do that, to make sure that the flow of your lessons and what you plan to have with your children for curriculum will continue to happen throughout the day. So the important piece is to make sure you have a plan, but also that the teachers have a checklist that they can refer to, because of course it's hard to remember all the things that we're working on and keeping children and their families safe, and also the staff. So the checklist, I wanted to just highlight 2 items that I thought were very important, is just to make sure there is a container on your counter where you can toss toys in that may need to be bleached because children are still mouthing and there are runny noses and colds that are still happening. And also with your dress-up clothes, make sure there's a bag or a container that you can place those things that need to be washed in the washing machine. The second thing I want to talk about is be very careful. Continue to wear your gloves, and when you're having exposure of bodily fluids like blood or urine or even poop or other things that children might be going through when they're toilet training, or if they're, having a difficult time and they're, there's a moment where there's some mucus that may come. And so make sure all those things are in place ahead of time so that you have those support pieces and systems that's in place in your classroom. I want to just say, again, feel comfortable in your room. This is still your classroom. This is still your joy. This is where your teachers and your children enjoy each other as peers and with being their adults. So have fun. Thank you.
Thanks, Christine. And I think that's a great point to remember is, this is a joyous place to be. And that joy does not take a vacation just because we have a health crisis, right? We can still feel joy. We can still be engaging in the classroom. So, what I heard from your story was, we got to remain intentionally focused on cleaning, a lot of cleaning, a lot of hand washing, a lot of making sure that the toys get into the bin that need to be disinfected. And that has to stay really in the forefront of our brain. But you know what? The building of relationships and the forming of secure attachments and social emotional development also doesn't take a vacation just because we have a health crisis. They are foundational to lifelong learning, and they're foundational to being just well-being of a person, of a human. And we need to keep the human part of care and development in the classroom and through the routines of our day. And we can use the guidance that we have. Checklists are great to have just to keep it in our head that what we need to do all the time. But let's not forget what children need all the time is our love and our support and an engaging environment. And so the guidance document you'll see in section 6 Lots of great information in the guidance document about spacing, about toys, about cleaning, about what to do with those dramatic play items, making sure that you wash them after use. So those are things that you can read about in the guidance, but we wanted to really stress today that there is a way to still have your normal routines and still have great engaging environments during this time of a pandemic. And you can read about the guidance and you can make sure that you incorporate that into your everyday routines. So we've moved into the classroom. And then what generally happens in the day in the life of childcare is, after working out in the classroom for a good long time, you get hungry. So mealtime comes next. So what happens at mealtime and those routines of mealtime and nap time and playground time? So we're going to turn it over to Shailene from the city of Hartford, and she's going to take us through those types of routines. All right, Shailene.
Hi, I know many of you have mixed emotions, but I'm here to assure you that not much has changed. Children still need to wash their hands before each mealtime. Family style now means that staff will serve children. Socializing is still encouraged. You may ask, how is this possible when you need to maintain 6 feet distancing? Children adapt quickly. Therefore, we place tape to provide visual support on tables and shared spaces to ensure distance from one child to another. Children are involved in the cleanup, just not in the setup, to prevent cross-contamination. Staff continue to model healthy eating behavior while at a distance, lowering their masks. Teachers continue to foster engaging, developmentally appropriate conversations while social distancing. Safety protocols continue to be maintained. Now there are more enhanced, and teachers have become more vigilant at cleaning, sanitizing, and disinfecting. To support social distancing, teachers have updated their classroom floor plan and redesigned seating arrangements for children. Nap time has now required to set up cots further apart. Excuse me, further apart. But as constricted spaces, we remain that head to toe practice, sleeping practice. During the transition or before and after nap time, we stagger children one at a time to ensure social distancing during toilet routines. Our daily schedule has adjusted to ensure new practices. Outdoor play structures are used with caution. Children have indoor and outdoor shoes. Sanitizing the playground between uses, outdoor play materials are no longer shared and are sanitized between each use. Just as a reminder, health and safety have always been an essential function of a teacher, but never forget the love that we have for children. Now I'm going to have Jennifer explain her experiences during the playground.
Thank you, Shailene. Although wearing masks is not required on the playground, as long as you can remain 6 feet apart, our staff members at our center do continue to wear their masks on the playground. This enables the staff to engage with children in close proximity on demand, because as we all know, children needing help or just needing a hug is not always planned. Group sizes continue to remain smaller for outside as well as inside. This recently has changed from 10 per group to 14. Outside time is just as important now as it was before the pandemic, and we're working hard to encourage the children to engage with others in safe and healthy outside play.
Thanks, Jenny and Shailene. So, we've heard again, some routines that still occur, but just with intentional focus on making sure that our group sizes are smaller. And Jenny had mentioned the group size has changed from 10 to 14 for children over the age of 3. We're still maintaining a ratio of 1 adult for every 10 children. Make sure that playground equipment is cleaned, sanitized. And looking at the guidance in the guidance document, you can have staggered outside playtime. If you have more than one group of children, let's make sure that we are staggering the times of use of the playground, but it is possible. Sections 3 and 6 of the guidance provide much of the information that you're going to need in order to make some decisions around what you would like to do in keeping everyone healthy and safe. And as Jenny pointed out, her program still wears masks outside. It's not required to wear masks outside as long as you keep a 6-foot distance. But we also know you're going to get that child running up to you for a big hug or someone needs assistance, someone needs help. So that mask must be at the ready. If you're not going to wear a mask outside, you must have it on you in order to put that on quickly when children come near and other staff members come near. So thanks, Jenny and Sharon, for that.
Deb, this is Michelle. A couple of people had a little difficulty hearing Shailene as she was talking about the family style food. I believe what she had shared was that they plate the individual food. So they're serving the child the food, but instead of children sharing the spoons and bowls, they receive a plate of food that is already prepared and set for them. So hopefully that clarifies for folks who didn't hear that.
Yes, correct. That's instead of the family served out of the single dish, it's now plated singly by the staff. There's also, we are not saying that you can't have food brought in from home either. So there are different ways to do lunchtime, but think very carefully about how meals are served. And making sure that you have the proper cleaning techniques for washing hands, of course, before and after, and spatially distancing children at tables and making sure that tables are washed down. But yes, you are correct. That is what Shailene had described. So we've gone through a few more routines, and this is a lot of information to think about, to share. And I know that OEC has come out with lots of information in a way to sort of like pull it all together in easy to follow formats that perhaps you could use in your communication with families and the general public. So I'm going to turn it over to Michelle, who's been working really hard on communication, and there's lots of great flyers about to come out. So Michelle, if you could take it away.
Sure. So OEC has been doing a lot of communicating, but also a lot of listening during this public health emergency. And we've been working to be responsive and provide resources that will help programs navigate things during this difficult time, this webinar and the guidance document being examples. One thing that we heard from programs is that there were questions about communicating with families about safety practices, both from the standpoint of providing some reassurance about sending children to care, and from a standpoint of being able to point to any requirements that were necessary, such as limiting group sizes, hand washing, masks, health screenings. So to that end, OEC worked with our wonderful partners at O'Donnell to create a toolkit of flyers that programs might print and use within their center. So these flyers will be available on our website soon, and they will be posted. They're on the first web page, or the first slide there were a few flyers focused on communicating with families, and one is really focused on what your program can do to keep kids safe, what you're doing, so to help reassure families and help them understand some of those practices. One is focused on partnering with families around keeping everyone safe. They play a big role in keeping their child home if they are sick, and taking other measures at home. And then there are also a couple of flyers designed to alert the folks who might be entering the building about wearing masks, about staying out of the center if you're ill. So Jill, you want to show the next slide there? She's operating, yeah. So there's a flyer just to alert anybody who might be entering the building. If you have maintenance workers coming in, families, other staff, just to take a pause and make sure people are aware of the requirements. And there's one regarding staff wearing masks as well. So these are optional. They're toolkits. They're things we're providing that programs can use. We hope that they're helpful, but of course programs may choose to create their own flyers. You may want to put your personal touch on the flyers. You may have individual protocols that you want to highlight and share with families. So team is going to share an example of flyer that they used in their program to share information with families.
Hi, thank you, Michelle. So again, I want to emphasize, forgive me for pointing out the obvious, that we have been and continue to be amidst a global COVID-19 pandemic. And all of us as childcare providers have been and continue to be looked upon as an essential part of that public health emergency response. And, that's filled with a lot of scary feelings, a lot of uncertainty, and recognizing that, and I underscore all that because you want, as a childcare provider, you want to be ready should the COVID-19 emerge directly within your site. And for us at Team Early Childhood, we experienced that, in the middle of the month of April. And we're here to share with you what really worked well was planning and preparation, remaining calm, and continuous communication. We have a responsibility to the well-being of our staff, the children and families, and the communication with all of our key partners to really produce the type of outcome we want to see amidst this public health emergency. We're going to share with you a couple of examples in this PowerPoint very soon of letters of communication that we had distributed to the families as well as the staff when we did have the confirmation of a positive COVID-19. And the story ends very well. So we had a staff member who was developing symptoms, had been a hero in the front line for our childcare program every day and week, and had been developing symptoms over the weekend, called out sick on Monday morning, and later in the day was tested positive COVID-19. And the end of the story is zero spread within our childcare program, and most importantly, the individual full recovery and is in a good state of health. Couple of things that what we really stayed ahead of, knowing that we were amidst a pandemic, was knowing our partners and having that at the ready. So you think about your childcare leaders, what is the contact information for your state health department, having that number at the ready so that you can notify them. Knowing your local health district, what is their contact information, and being able to contact them. Knowing your Connecticut Office of Early Childhood and specifically your licensing unit so you can notify them. And then having letters ready to send specifically to families and staff based on that public health and expert guidance as far as what team had to do, including exclusion of those who had direct contact and other circumstances where we had to shut down one of the rooms and do a number of levels of cleaning and so forth. So I'm going to pass it over to Jamie Peterson, our Director of Early Childhood, who's going to give you a little more granularity on what it looked and felt like from the point where we confirmed that we had a direct exposure of COVID-19 in our childcare setting. Jamie.
Sure. Hi, well, thank you for allowing me to share what occurred in our program. As David mentioned, we've been open throughout the pandemic, and back in April, we had a staff report for her shift. She was on shift for 5 hours on a Friday, and she went through her well check, no fever detected. During her well check, no symptoms. She cared for 5 children in the morning on a Friday, went home feeling fine, started not feeling great on Saturday. By Sunday, she was feeling pretty crummy. So as described, her physician told her to get a rapid test. And Monday at 1:30 p.m., when the center was open, we received a call from the staff that they were indeed positive for COVID-19. So as a program director, my first reaction is, wait, this wasn't supposed to happen here. And it is. And how do I take care of all of the staff in the building, the children, the families, not only the ones in the room, but the ones that are in the building with her as well. Then I thought about the visitors. You know, we did have a maintenance person come in that day who did go through a well check as well, but I have to notify them and make them aware of what occurred. So really turning to our local health department was key. Our OEC and the licensors were incredible. And then we have a close relationship with the hospital locally, and their guidance helped us in developing the letters that you see on the PowerPoint right now. One speaks directly to the children that were in care, and the other speaks directly to the visitors and the other children that were not directly in care. I should note, I was in the classroom that day with the staff person, our food service person was in and out, our front secretary. We did end up quarantining the 5 children that were in care, and clearly the staff had to take a leave to recover. But I did not have to quarantine myself due to the limited proximity of time. We were practicing good social distancing. This even occurred before the executive order for face covering, so we were not masked that day, but the increase in the universal precautions and the fact that we were practicing social distancing was really in our corner. We did do those letters. You know, those were letters I did not just leave for the families in the front foyer. I handed those letters, I had a conversation, and the key points in the conversation was really a reminder to the families of all the things we do each day to stay healthy, to stay safe. You know, we're in this together. I'm a mom, you know, and we're all thinking of, we want good, healthy outcomes throughout this. So handing in that letter, having that conversation, being available and open for follow-up questions if need be. You know, there was one family in particular that was not mandated to quarantine because they were not in the room, but they chose to keep their child out for the following week. So we had to be respectful and honor every family's decision as we kind of navigated the course in front of us. So as David mentioned, there was 0 transmission. It was a great ending. The teacher is now back to work. She's fully recovered. She tested positive for the antibodies. So she's here. She was on shift today. And we really attribute the no transmission to our universal precautions and practices that we have in place. Deb?
Great. Thank you so much, David and Jamie. And you know, you kept us grounded here in reality that we are in a health crisis. And while we do our best to make sure all precautions are taken and children are still able to be actively engaged in learning in our programs, COVID-19 is here. The virus is here. And so everyone should consider your level of readiness. Should a child become ill or a staff member become ill in your program, consider what you need to do. Section 8 of the guidance, it has wonderful information about what you would need. And actually, David and Jamie went through a lot of that. Letters, those phone numbers, please make sure that you have those phone numbers ready. The Department of Public Health, that's one of your first calls, making sure that you have your letters ready as if something is going to happen, so that you have the emails of the parents, you know how to get in contact with everyone. You have transparent communication with all of your families about what happened, about what happens next, and to follow the guidance of the Department of Public Health. It's really important to have everything at the ready, and the guidance document will help you do that. Keep in touch with the CDC guidelines and any information coming out. But I think David and Jamie, you gave a great example about how this crisis really does weigh heavy on our hearts and minds. We know what we need to do, and we can find the information we need on websites and share ideas with one another. Two of the most important things, you mentioned, is having those precautions. And this was at a time that you had mentioned was without having masks at the time, was not a requirement. So now that we have masks as a requirement, we're doing more and more hand washing all the time. And we are making sure that we are sanitizing, disinfecting, washing everything all the time. We have lots of precautions in place and social distancing. So please just have everything in the forefront of your mind. Wearing the mask is so important. Being prepared is so important. and making sure that those children have fun and engaging experiences, and it can still happen. So we're going to close out a little bit today with a little fun with wearing masks. Masks aren't exactly fun to wear for 8 hours a day. We get it, I totally understand, but there is a way to wear masks, and we'll show you a little bit of that after. And Lynn and Chrissy are going to take away here with a little fun with wearing masks.
Hi, you saw us before, and here we are again, looking very different. But that doesn't mean that our emotions aren't still inside. We just need to learn how to express them on our face. So here we were before, here we are now, but we still feel joy in what we do. We can express it in different ways. Okay, we can also express if we're not feeling great. We could also say, hey, wait a second, I'm just feeling normal. All of these things are so important because we are still expressing ourselves, and we can raise our voice or raise our hands in some fun. Yes, and we can even do some body movements to let everybody know how important the social bonding and the interactions are with children. Even though we are behind a mask, what we say and what we do is so important in everything we do together. Together, we're going to get through this. And together, I can't even begin to explain how much I have seen changes in everything that we're working together. We've worked with the state, we've worked with local communities, and together we're going to see this through. Most important is to work with the children. I love the data that says 4-year-old children laugh about 400 times a day. 40-year-olds, about 15. Together, sharing, let's all make a difference as we move ahead to better times. Thank you, everyone.
Thank you.
Thank you so much. I don't know how to follow up with a good closure for that, because that was so, awesome. One thing, I'm a person who wears glasses. Okay. And so what I have the most problem with is not my body movements, because I can do the happy dance all day long. It's about not fogging up my glasses. So I just wanted to put on a mask, and the proper way of wearing a mask over that nose and putting those loops around and pulling it down, and people with glasses push that mask right up underneath your glasses and they shouldn't fog up. Okay, and there's also some other tricks of the trade in terms of putting soap on your glasses, because I know that's a pain for people who wear glasses. It's kind of my pet peeve. But when I go to the grocery store, I always say to everybody I meet, I'm smiling underneath my mask. We've got to be able to express our joy, even though we are wearing masks. And so I thank everyone on the call today for providing your stories. Michelle, did we have any more questions that we wanted to go over before we close out?
Sure, there's a couple of questions. There were actually quite a few questions, and some of them are addressed in our guidance. So I do want to just point people to both the guidance document that should be posted shortly. Hopefully by the time you're off this webinar, you'll be able to find that on our website, and if not immediately after, it will be posted very quickly. And as well as the flyers. We also have frequently asked questions that we update frequently on our website. So that is a great source of information, and we will be looking through all of the questions here and updating that frequently asked questions portion of our website. So that's a great place to check, certainly. I know some folks were really wondering about the social distancing, which we touched upon, and that balance between providing the emotional support and care for children, in addition to maintaining as much distance as is feasible, and not mixing. Figured I should turn on my camera so everybody's looking at Deb sitting there still while I'm talking. There were a lot of folks who were really interested in some of the flyers and the materials that were shared. So we will look into sharing things such as the PowerPoint. I'm not sure what our process is for that, but we will look into that. People were certainly interested in some of the resources that team shared, and we're impressed with their handling of the situation. So one of the questions was around playground equipment and cleaning that. There's no specific requirement of who cleans. You saw the cleaning checklist that team shared with us, and it's really a process of your staff and making some plans for what works for your staffing and your program in order to accomplish those cleaning of equipment. Someone typed in a really great reminder regarding masks and the touching and removal of masks and taking good care. There's some great resources out there regarding how to handle masks, and we encourage you to look for those. Another thing related to masks, and this is something that we have covered in our frequently asked questions, is related to the possible use of face shields, which are clear. Face shields in and of themselves do not meet the requirement of face masks, which need to be snug and fitted against the face. So please look to our frequently asked questions for more information there. There are, I believe, some places that have made and made available clear face masks, which do meet that requirement, but the face shields that do not fit snugly against the face do not meet that requirement. So for more information, again, our frequently asked questions does address that. So one other thing I just want to touch upon from the questions, and then we will let folks go back to their routines, is around the crossover of staff and children and families, the intermixing of groups and children. In general, both with the mingling of staff and children, the mingling of staff and children is something that does increase the risk of the potential spread of the virus. So keeping children in consistent groups, minimizing the amount of time and contact with other family members is ideal. If you're wanting families to visit the program, thinking about arranging that at times when others aren't present in the center might be an option if you're bringing new families in. The more that as you listen to the story, to what Jamie shared about their contact and how they had to think about all the different people who were affected when they had a positive case in their center, each time of contact endpoint, you have to think about contacting those folks, the risk of exposure to all those folks. So by keeping consistent groups, you keep that smaller and reduce the number of people who might become ill or who might have to quarantine in the case of a positive case. So that's some highlights from the questions. And Deb, I'll turn it back to you to finish out. We will look through the rest of the questions and look to add some things to our frequently asked questions.
Great, thanks, Michelle. Thanks for taking charge of going through all the questions and keeping us together on all of that. And I just got word from Maggie that the guide is now posted on our OEC COVID landing page. So if you go to our general OEC website and click on the COVID-19 link there, you will find the new guidance document that you'll see all of the great things that we just highlighted and talked about today. So, you know, thank you for everything that you do. And we hope that these stories from real providers living this since March, they've been open the whole time, has inspired you to really think about what you're doing, how you're doing it, how you'd like to do things. And it is a time to lean on one another and share resources so that we can learn from one another. And that was really like the point of doing it this way, is so that you see and you hear from your peers and that you know that people are doing this, and we can get together and we can share things between each other to do things better all the way around. And every center may be a little bit different. Not everybody has 3 entrances to their building. So you need to think creatively on how to do things. So again, thank you for all you do for children and families. And we hope the stories from the providers inspires you to think creatively. We know it can be done, and think about the foundations of early childhood and those relationships and those attachments that still can happen, and those great experiences for those children can still happen even when we are in a health crisis. So I appreciate your attendance today. On behalf of all of the OEC team out there, thank you so much for everything that you do, and be healthy, stay safe, be good to one another. All right. Thank you so much for sharing. Bye.